We are Hopscotch, a pediatric behavioral health platform helping children reach their fullest potential and supporting parents through each milestone of their child's development. Pediatric behavioral health conditions are on the rise, and the shortage of providers is only growing. Reports show that up to 85% of children aren't getting the treatment and support they need. This is where Hopscotch comes in. We are working with doctors to create a digitized and gamified treatment plan that provides access, support, and resources for stakeholders at each stage of the value chain.
Hi everyone, my name is Marla, and I'm here with my colleague Nicole, and we're so excited to talk to you today about our company Hopscotch. 2 years ago, I was working in a children's hospital where every day I was directly interacting with parents who had a child struggling with a behavioral health condition. During this time, I became intimately familiar with the struggles that these parents and children faced surrounding accessing the treatment and support that they so desperately needed. What especially broke my heart is that most of the individuals at the clinic had been waiting over 6 months to receive an initial consultation, and research shows that many of these conditions could have been prevented had these children received intervention at the appropriate time. Our mission is to help these children access the treatment they need so that they can reach their full potential, while also supporting parents through this isolating and overwhelming journey. While a key motivating factor for us is to provide the best possible treatment and support to children who are currently diagnosed with a behavioral health condition, our ultimate goal is to equip children with the necessary tools so that all children are armed with powerful skills to help them regulate their emotions and deal with challenging situations as they navigate an increasingly complex world.
Our motivation stems from the fact that mental health issues are the most common childhood disorders, yet up to 85% of children are not receiving the treatment and support that they need. This is due to various reasons, such as a shortage of behavioral health providers, issues with care coordination, a lack of engaging and useful resources for parents and children, and an inability to afford care. The world we live in today is especially primed for a company like Hopscotch because of the increasing prevalence, a supply and demand gap that is expected to worsen, an increased need for convenience among parents, and an acceptance of technology with a demand for personalization among consumers. An overview of the platform is shown here, with the parent filling out an onboarding and screening form. From there, the parent might be prompted to schedule a telehealth consultation depending on the child's risk assessment. The content that is assigned to the child's profile will be based on the risk assessment form and based on what the clinician assigns for those children who have telehealth consultation. Parents will also have access to a community of other parents and curated resources. A critical component of the platform comes in the form of our digital and gamified exercises that we have created for children. We have worked with doctors and children to innovate traditional exercises that will incentivize the children to engage in their treatment with the goal of improving adherence and outcomes. The business model is multifaceted and involves integrating with insurers and then bundling and selling the service to self-insured employers. We also will be working directly with private practice clinicians, and our phased go-to-market strategy will be highlighted in a couple of slides. Targeting employers will allow us to capitalize on an opportunity by helping employers with a problem they are desperately trying to solve. Working parents who have children with behavioral health issues is way more costly to employers than it needs to be.
We've already begun speaking to and have garnered interest from a number of regional health insurers. Additionally, in tandem, we'll be selling the usage of our platform to private practice practitioners. We currently have a waitlist on our website. During phase 2, after we've had the chance to gather data and prove our proof of concept, we'll begin selling to larger insurers who hold Medicaid contracts, as well as contracts with self-insured employers. This is a large and growing market. Recent findings presented at the American Academy of Pediatrics National Conference highlighted that between 2012 and 2016, pediatric emergency department visits for mental health problems increased by 56%. We spent the first part of our journey conducting over 250 interviews with parents, children, clinicians, insurers, and employee benefits managers. From there, we were extremely fortunate to have been able to partake in both eLab at Cornell and Harvard Innovation Lab's Spring Accelerator program. We've worked with the clinicians on our team to develop our MVP, which will be launching early next month with 2 cohorts, a community-based cohort in Boston and a hospital in New York City. Our clinician and parent dashboards will be complete in June, and we'll be spending this summer continuing to develop our child-facing content and treatment programs. We're incredibly thankful to have a team of absolutely incredible technologists, clinicians, and business minds behind us on this journey. Our advisors are thought leaders in child and adolescent psychiatry, world-renowned researchers in developmental psychology, and executives at large health insurers. We also wouldn't have been able to complete what we have done so far on such a small budget without our team of amazing undergraduate interns who have been working with us. Thank you so much for your time today and listening to the journey that Hopscotch is on. If you know of any pediatric behavioral health providers who would benefit from this service, please direct them to our website at gethopscotch.com. We'd also love to chat further with anyone who is interested. Please follow up at marlabeyer@gethopscotch.com. Thank you so much and stay healthy.